Good evening. My name is Dorothy Lever, and I'm a diabetes education coordinator at St. Luke's Cornwall Hospital. Tonight, we're here to talk about nutrition, but nutrition is a big part of diabetes management, but there's a lot of information, a lot of knowledge that you need to incorporate and work with in order to truly control your diabetes. So Megan's going to be talking. Megan's one of our clinical dietitians, and she's going to be talking about the nutritional part of it. But I wanted to talk prior about the programs that we have available at the hospital right now. They're outpatient programs, and we actually have two. Lindsay, would you progress the slide, please? The first program that we have is the Diabetes Self-Management Program, and it's a program that we've been running at the hospital for the last 25 years, actually, and it's for people with type 1 or type 2 diabetes. And it's based on the knowledge that if people can control their diabetes and get their blood work and their blood sugars into the range of a non-diabetic person, which is doable, then they won't develop the complications. Very important. Diabetes is a pain in the neck because you have to diet, you have to exercise, you have to do what we all should be doing. But the real problems that come from diabetes happen because of the complications that can happen if your blood sugars are not under control. So this program that we've been running, it's 8 to 10 hours in length. It's accredited by the American Diabetes Association, and that means that we follow all of their standards, all of their guidelines. We utilize a curriculum that they recommend, and we offer it in a variety of different ways. Right now, all of our programs are on Zoom. So if you do decide that you'd like to come and be part of either of the programs, we're doing them all on Zoom. But under normal circumstances, we meet face-to-face and we do the programs in group sessions. We do them one-to-one. However, the patient, really whatever works best for them and their learning needs. Like I said, it's an 8 to 10 hour program. So once a month under normal circumstances, we do an all day program where people come in at 9 in the morning and they stay till 5 in the afternoon, and they learn pretty much everything they need to know to start to control their diabetes. Some people it's not doable for, some people it works well for because, and it's somebody who's working maybe, or somebody who wants to get everything in one day and not give up other time. Other people prefer to break it up and to come back for the continued support, or they can't absorb all that much at one time. So however you want to do it, we'll do it with you, whatever's good for you. Lindsay, progress. So the topics that are covered in the Diabetes Self-Management Program, first of all, what is diabetes? What's the difference between type 1 and type 2? Who gets diabetes? But also, how do we treat diabetes? How do you get your blood sugars under control? We talk about blood glucose monitoring, the different types, difference between the information that you get from hemoglobin A1C versus continuous blood glucose monitoring, and what's best for your individual needs, and what numbers you should be looking for, what your goals should be in terms of blood sugar numbers. We talk about medications, and we talk about medications that you're taking and help you to understand your medications better. But we also talk about all the various classifications of medications that we could be using to control diabetes, so that you're aware of what your options are. We talk about stress and diabetes. How do you control your stress? How do you get support? What does stress do to you physiologically in terms of your diabetes management? And we talk about nutrition, and the dietitians do that part, which Megan's going to be talking about nutrition tonight. And what do you do? What are good diets? What are healthy diets? What do you have to watch, and all of that? We also talk about complications and how do you prevent the complications? How do you identify whether you're beginning to have complications? What are the treatments? And all of that. We talk about sick days and travel. What do you do if you're sick, if you've got the flu, if you've got a virus? Should you be taking your medication? How frequently should you be monitoring your blood sugar? And give you information about that. And what medications are okay to take over the counter for people with diabetes. That sort of thing is covered in that session. The other thing that's very, very important when we talk about diabetes management that a lot of people aren't aware of is that type 2 diabetes is based on an insulin resistance. So we talk about ways that you can decrease your insulin resistance, make you able to use your insulin better. So we would be talking about such things as aerobic exercise. And how does that work? How does that work to get your diabetes under control? So those are all the topics. And like I said, we do it in an all-day program. We break it up into 2-hour days. We break it up into 1-hour days, whatever works best. And right now it's all on Zoom. The other program that we offer at the hospital that we've been offering for the last few years actually is the Diabetes Prevention Program. And Diabetes Prevention Program is a program that's actually 2 years in length. It was researched by the Center for Disease Control. It's a lifestyle change program. And it's based on their research findings. And what they did is they actually took 3,000 people, broke them up into 3 groups of 1,000 people each. One group they gave placebo to, another group they gave the lifestyle change program to, and the other group they gave the first line drug that we use to treat diabetes, type 2 diabetes, and that's called metformin. Some people are maybe familiar with it. And what they found was that the people that got the placebo, nothing, just what you would expect. With the metformin, there was a 30% decrease in the onset of type 2 diabetes, but the people that took the lifestyle change program were 60 to 70% less likely to go on to develop type 2 diabetes. The program, like I said, it's 2 years in length, and it's designed to promote weight loss and to increase activity level. 2 things that really have an impact on the development of type 2 diabetes. Who should attend this program? Like I said, it's designed for people that are at risk for type 2 diabetes. So if you're somebody who's been told by your healthcare provider that you have prediabetes, meaning that they've looked at your blood work, your fasting blood sugars may be a little bit high, not enough that you would be diagnosed as having type 2 diabetes, or your hemoglobin A1C is a little high, same thing, not enough that you've been diagnosed as having type 2 diabetes, but that you're in danger of going on to developing type 2 diabetes. Any woman who's had gestational diabetes is automatically a candidate for the program because those people that women have gestational diabetes are twice as likely as anybody else to go on to develop type 2. So they're automatically candidates. And the program is particularly effective in high-risk people over the age of 60. So in addition to this group of people that's up there, the other group of people that would be considered a candidate for this program is somebody that maybe took one of the risk factor tests. You can find a risk factor test on the American Diabetes Association website and the Center for Disease Control website. And it actually gives you a score about what your chances are for developing type 2 diabetes. And if you're high risk for developing type 2 diabetes, it's an excellent, excellent program. Okay, that's my contact information. But the other thing I just want to say about the diabetes prevention program, it's 2 years in length. The first 6 months, we meet almost every week. People under normal circumstances, like I said before, right now we're on Zoom, but under normal circumstances, every week, everyone in the group comes into my office. We get weighed in. I collect your activity logs, and the goal is for everybody to do at least 30 minutes of physical activity 5 days a week, and to commit to a 5 to 7% weight loss in the first 6 months. And after that first 6 months, we meet every other week. And then in the last year, it's about once a month, maybe twice a month in some instances. We have a set curriculum that was developed by the Center for Disease Control. And it's a very, very excellent program. It really is. I can honestly say that of everyone who's ever come to the program, they've all had good changes in their hemoglobin A1Cs throughout the program. That's my number, my telephone number at the hospital. My office is at Cornwall. And I'll be happy to answer any questions. If you know anybody that you think would benefit from the programs, please let us know. And I'm going to turn the program over to Megan Walters, and she's going to talk to you about food, everybody's favorite subject. Okay. Thanks, Megan.
Thank you, Dorothea. Hi, everyone. Yep, my name is Megan Walters. I'm one of the dietitians here at St. Louis Hospital. So I'm primarily here in Newburgh in the inpatient facility, but we also do offer outpatient counseling over in Cornwall. And as Dorothea mentioned, we also participate in her programs to review the nutrition and diet components of diabetes management and prevention. So a couple objectives of what I'm going to cover here today. I'm going to review the risk factors for diabetes, some methods to overcome some of these risk factors. Of course, I'll review diet and nutrition information, and I'll touch a little bit on physical activity as well. So risk factors for diabetes include obesity, leading a sedentary lifestyle, having a family history of diabetes, a history of glucose intolerance, a history of gestational diabetes, and people of certain races and ethnicities. So Dorothea just reviewed a lot of these things. There's a lot of components that qualify you for her programs. I'm going to focus primarily on these first two, obesity and sedentary lifestyle. So these two components are what we call modifiable risk factors. So in theory, these things can be changed. We have a little bit of control over them ourselves based on our behaviors and our lifestyle choices, primarily through diet and physical activity, of course. So diet and physical activity are the main components that we're going to be reviewing. So when it comes to weight, we of course have this BMI scale, which is often used for reference within the healthcare field. So this is a number determined based on your height and your weight. You're then classified into a category based on those two components. So you can see on this scale, on the left, we have height, and across the top, we have weight. Different colors represent different ranges of BMI. So light blue is the underweight category. Blue is, I don't like the word normal, so I'm going to call that the more desirable range. Green represents overweight, orange represents obese, and red represents morbidly obese. So falling within the green, orange, or red categories is associated with an increased risk for diabetes. And it has been found that a slight reduction in weight for people within these categories, even just 7%, can lower your risk for developing diabetes by about half. So this reduction might be about 10 to 15 pounds. It can also help to reduce A1C in those who already have a diagnosis of diabetes. Just a couple of things I'd like to point out. This scale does not take body composition into account. So it doesn't factor muscle mass, for example, so it's not always 100% accurate, but it can be helpful in determining risk factors and things like that. I also want you all to take a look at the left column first, so take a look at the height, and then look at the weight and how that changes. So I think a lot of times it's common to feel that a certain lower number on the scale might seem more desirable, or that a higher number might seem like too much to you without any actual context. But you'll notice as height increases, weight also has to increase in order to stay within that desirable range. With that being said, weight loss is actually something I don't like to encourage people to use as a primary goal. It might seem strange, but the reason is a lot of times when people are making behavior changes with a primary goal of weight loss, they tend to take on some pretty extreme practices, which might not necessarily be health promoting behaviors. Weight can also be deceiving. So as I mentioned, there are factors like body composition. So it's not always an accurate representation of your health. And that if the number on the scale doesn't change while you are making adjustments to your lifestyle, it can be discouraging and maybe even reduce your motivation to continue on this health journey. A lot of people tend to focus on weight, which I think is very understandable because it's what we see, right? It's what we see when we look in the mirror. We don't look in the mirror and see our blood sugars or our cholesterol levels. We don't see our blood pressure levels. So because it is what we see, oftentimes it's what's prioritized. But that's not what I want you to focus on. First, I want you to focus more on those lab values and prevention and management of diseases. Body positivity is an important part of health too. You can see on the right side of my screen here. It's important for both mental and physical well-being. So keep that in mind. Respect your body for what it is and all the things it's done for you because you're so much more than your weight. Trying to achieve weight loss through extreme measures can also lead to something called weight cycling. So this is also known as yo-yo dieting. You may be familiar with the term. This is a pattern of adapting a diet for a period of time, potentially experiencing some weight loss, followed by a return to old behaviors, which results in a regain of that weight. So it's actually been shown that this pattern can lead to additional weight gain in the future. So people lose weight and not only regain the weight that they lost, but may actually gain even more than what their starting weight was. So this is most often the weight gain is found within the abdominal area. It's not entirely clear based on research if this weight cycling habit contributes to disease risk, but it's certainly not helping to achieve that weight loss that resulted in trying to diet in the first place. Part of the reason this happens is the diets people gravitate towards in our society tend to be very restrictive. So they may eliminate or severely restrict certain foods, maybe even whole food groups. They can lead to us labeling and viewing foods as good or bad. They can cause people to maybe eat the same foods every day because they feel they don't have many other options. Sticking to these really rigid food rules can even lead to feeling shame or guilt surrounding food choices. Choosing a food that's quote unquote bad might make you feel guilty. Ultimately, that's an unhealthy relationship with food. That's not ideal, and that's not what we want to see. In some cases, this can even lead to an eventual overconsumption of those restricted foods because you deprive yourself of them entirely. So ultimately, it's not sustainable. It's not going to last long term, and it's not even really necessary and can even be dangerous. As I mentioned, this can affect your relationship with food. It can make meals feel overly complicated or stressful. You may even feel out of control around certain foods. And it's really not what we want to see. Food is not the enemy. It's important for a lot of things. And there are things we can do to kind of overcome this so that you're achieving your goals without dealing with all these negative side effects. So first, transitioning from this restrictive mindset to a more mindful mindset can make a big difference when it comes to planning your meals and choosing your foods. So mindful eating encourages us to pay attention to our food and our experiences with food and help you listen to your body and its natural cues. So noticing when you're physically hungry, noticing when you're starting to feel full, so that you're not eating when you don't feel hungry, in terms of, maybe emotional components, stress, anger, things like that. And also, not eating to the point of feeling uncomfortable. It's important to understand that foods don't necessarily need to be eliminated from your diet entirely. They may just need to be enjoyed in more moderation. So this can be accomplished by limiting distractions while you're eating, sitting down to eat your meals versus eating on the run, and trying to eat more slowly rather than trying to eat as fast as you can. I understand sometimes convenience is a factor, but trying to work towards incorporating more of these habits can help with transitioning to a more healthy eating pattern and preventing that restrictive mindset. It can also help to regain your confidence and sense of control around food. So what does that actually consist of? What should a diet look like? So in addition to being more mindful, knowing how to plan and how to choose foods can help with improving your health as a whole. So as a dietitian, I like to promote balanced eating because it's more sustainable, more likely to lead to lasting lifestyle changes, which is what we want to see. So we have 5 food groups. We have whole grains, fruits, vegetables, low-fat, dairy, wheat, protein. These are our 5 food groups that each contain different nutrients, different vitamins, different minerals. So they all have their place. They're all important. Eating regularly throughout the day is important for a lot of reasons. It can help to make sure you're taking in enough calories, enough protein, enough vitamins and minerals. It can also help to promote and sustain energy. It can improve blood glucose control for, if you do have diabetes already. When we eat food, our blood sugars come up. They start to come down when it's time to eat again. And that's kind of what we want to see, right? We want this nice little roller coaster. And that's people with diabetes and without. That's how our blood sugars work. We don't want anything up here. We don't want anything way down level either. So eating regularly throughout the day can help to control that blood glucose. And it can also help to give you more control over your food choices. So if you wait to eat until you're feeling very hungry, or if you tend to go all day long without eating a meal, you might find yourself at the end of the day reaching for quick, easy foods, which might not always be the most nourishing or the most satisfying options. So by eating regularly throughout the day, you can prevent that reaction, so you plan a meal or snack that will sustain you for a longer period of time. This picture is called My Plate. So this is a diagram that replaced the food pyramid a few years back. I like it because I find it to be more user-friendly. So if you remember the food pyramid, grains were on the bottom, but what does that mean? How much can you actually eat, right? So this helps to put that into context. So if you have a plate, this is approximately what a portion size should ideally look like. So we have grains in that top quarter, we have protein in that bottom quarter, we have vegetables representing half the plate, we have on the side fruit, and then that glass that looks like water does represent dairy. So this can be helpful in planning your meals, kind of trying to decide what do your meals look like at this point in time. Are some of those portions a little skewed? Do you have more carbs on your plate than you have vegetables? Maybe the protein's taking up more of the plate than your other food items. And sometimes that's okay. All of your meals aren't going to look like this. All of your meals aren't going to have all 5 food groups, and that's okay. I do recommend trying to include at least 3 food groups per meal, just because, as I mentioned, they each have different nutrients. So getting a variety of foods is important for getting a variety of nutrients. I'm going to run through each food group and kind of discuss what kinds of things to look for when you're choosing an item within that food group. So I'll start with protein. So choosing leaner protein options is more optimal. Things like chicken, turkey, and fish are lower in saturated fat, so they're more heart healthy. Plant-based options are also great. So things like nuts, seeds, legumes, those are also really great sources of protein that are even lower in saturated fat than those lean meats. Ideally, we want to choose foods that haven't been fried. So baked, broiled, grilled, those are all more heart healthy options because they'll have less fat as well. When it comes to choosing meat-free products, so like the Beyond Burgers, things like that, there's a lot of items out there now. Keep in mind, you still want to check those labels, and we'll get to label reading at the end. Sometimes those items might still be a little bit high in sodium. They might be a little bit high in fat. So depending on those qualities will help to determine how they fit into your diet. But reducing your total intake of animal protein and substituting in some plant-based protein is beneficial for a lot of reasons. Like I said, it's good for heart health. It's also good for diabetes. When choosing grains and starches, we have a slogan, recap your grains whole. So fiber is an important part of a healthy diet. It's helpful for reducing inflammation, keeping the body regular. There's a lot of really wonderful components that come along with fiber. So when you're picking a grain food, ideally you want it to have at least 2 grams of fiber per serving. Ideally more like 4 grams. That would be a high fiber food. It's definitely something that most Americans are lacking in. The average American eats about 13 grams of fiber per day. The goal for women is 25 grams and the goal for men is 35 grams per day. It is quite a bit. So including more whole grain options is a great way to help to increase your total fiber consumption. It is something you want to do gradually though. So if this is something you decide you want to start working on, you want to increase your fiber by about 5 grams every couple of days. As you do so, you want to make sure you're also increasing your hydration, because in order for that fiber to do its job, it needs that water there too. This food group, grains would be things like bread, cereals, rice, pasta, but it would also include those starchy vegetables, so things like potatoes, corn, and peas. So they're still a great choice. They still have lots of really great nutrients and fiber, but in terms of the portion size, you want to think of them in that grains portion of the plate rather than on the vegetable side. For fruits and vegetables, as we saw in that My Plate diagram, they did represent half the plate. The goal is 2 servings of fruit per day, 3 servings of vegetables per day. Eating a variety of colors is important because different colors represent different nutrients. Any kind of fruit or vegetable is important. They're all great choices. You can be fresh, frozen, or canned. They don't have to be organic. It's really up to your preference and your budget. They're a great source of antioxidants and phytochemicals. They're definitely something that a lot of us could benefit from eating more of. So if right now your plate does not have half of it consisting of fruits and vegetables, that's okay. But consider it as an area for improvement to start working towards. These also, of course, are a good source of fiber, just like those whole grain foods. So it is something, again, that you want to increase gradually and make sure you're increasing your water intake as well. A serving of a fruit or vegetable would be 1 cup of raw fruit or vegetable or a half cup cooked. Also, like a small apple or small orange would represent 1 serving. Dairy products, just like with our protein options, we want to try and choose lower fat items. So 1% or skim for milks, yogurts, and cheeses. There are also lots of non-dairy options out there now. There's soy milk, we've got cashew milk, we've got rice milk, almond milk, there's a ton of them. All of these are fine. It's really up to preference. They aren't all considered equal. So for example, almond milk is much lower in protein than say like regular milk or even soy milk. So depending on how you're using it in your diet, if you're using it as a protein source, almond milk might not be the best choice. But if that's your preference, you can absolutely use that, it's no problem. The one thing you want to pay attention to is added sugars and even sodium. So with those non-dairy options or even with like yogurts of any kind, sometimes those flavored ones have a lot of added sugars in them. So ideally you want to go for the unsweetened or the original kinds to help to reduce the amount of added sugars you're consuming from these foods. With cheeses, sodium is something that you want to pay more attention to. A serving of cheese would be an ounce. Items that are lower in sodium would be things like Parmesan cheese, mozzarella cheese, Swiss cheese. Those are all slightly lower in sodium. Sodium being, of course, reducing it is helpful for cardiac reasons and helping to control blood pressure and things like that. So getting into more detail as far as the carbohydrate foods go. So this is a list of the items that contain carbohydrates. So of course, carbohydrates are the foods that are going to affect your blood sugars most. So we have grains, starchy vegetables, dairy, fruit, and then snack foods and desserts. All of these things are still fine to eat. As I mentioned, each food group has different nutrients that our body needs to function at its best. So you shouldn't ever feel like you can't eat these foods because you can and you absolutely should. Some of them, of course, are those kinds of foods that maybe need to be eaten in more moderation, while others can be eaten more frequently. So this diagram can help with portion control, especially for those of you who have diabetes. So one carb choice is equal to what we call 15 grams of carbohydrate. So each one of these bullet points is one carb choice. So one slice of bread was one carb choice. 8 ounces of milk would be one carb choice. So when it comes to planning a meal, keeping this in mind can be helpful, but also when trying to fit in foods that maybe need to be eaten in more moderation, knowing the amount that you can include throughout the day can be helpful so that you are able to still include them and enjoy them without it being detrimental or really causing an excessive increase in your blood sugar. So in general, for weight maintenance, men can have 4 to 5 carb choices per meal. For women, 3 to 4 carb choices per meal. If you have a goal of losing weight, it would be slightly less. So for men, then 3 to 4 carb choices per meal, and for women, 2 to 3 carb choices per meal. Keep in mind, this is just a general recommendation. The total carbohydrates you need per day is going to depend on the person. It's going to depend on your height, your weight, your activity level. But this is just a general guideline. So for the whole entire day, again, a general guideline for women will be 10 carb choices, for men will be 12 carb choices. So remembering that 15 grams of carbohydrate is one carb choice, that would be 150 grams for women, for example. So as for label reading, remembering that 15 grams can be helpful when you're looking at a label to help to determine how the food's going to fit into your day. There are a few other things we want to look at as well when we're looking at food labels. So you want to start at the serving size first. If you are eating twice the serving size, you have to remember that you're then doubling the amount of everything else on this label, which in some cases is fine. So in this case, the serving size is 2/3 of a cup. You want to also look at the saturated fats, the trans fats, cholesterol, and the added sugars. So these are the things that we want to try and limit. As a guideline, I like to use that number on the right-hand side, the percentage. So, for example, saturated fat in this situation is 1 gram, which is 5% of your daily value, which is right where we want to see it. So 5% is a nice, easy number to remember when you're standing in the grocery store. So if something that we want to limit is 5% or less, that's going to be a fine choice. Total sugars and added sugars, you'll notice have different numbers. Those are 2 different things. So for example, let's say fruit has some naturally occurring sugars, whereas an added sugar might be something like high fructose corn syrup. So this food item might contain some naturally occurring sugars from fruit, but also has added sugars included as well. You also want to make sure you're checking the ingredient list. So after you look through these numbers, you see that saturated fat's not so bad. The sodium is at 7%. It's slightly above 5%, but that's not so bad. We have no cholesterol in this food choice. The added sugars are a bit high though. So I want to take a look at the ingredient label next to see which kinds of sugar this includes and also how high up in the ingredients list they are. So the ingredients lists are printed based on quantity. So the more amount of an ingredient included in the food, the higher up on the ingredients list is going to be. So if sugar is within the first 3 to 5 ingredients, might not be the best choice. It also might just be a food to eat in more moderation versus more frequently throughout your day. So there are a lot of words for added sugars. I've listed some of them here. I'll just run through. So brown sugar, corn syrup, sweetener, anything ending in OSE. So dextrose, fructose, glucose, lactose, maltose, sucrose, high fructose corn syrup, fruit juice concentrate, honey, and agave would also be included on here. So although honey and agave are naturally occurring, they're not naturally found in foods, so they do still count as added sugars. Added sugars are, of course, something we want to limit, but they aren't something you need to entirely avoid. The general recommendation for women would be about 25 grams per day. For men, it would be more like 35 grams per day. So they are unfortunately found in a lot of foods, a lot of packaged foods, a lot of processed foods. So starting to pay attention to maybe sources of added sugars within your diet might be a great place to kind of start. To see how much you're taking in at this point in time and see if there's room for improvement. Maybe you're right where you need to be. Maybe you're over consuming slightly. And then try to pinpoint the kinds of foods that are contributing to that and deciding if there's something that you can reduce. So a lot of times people ask me, what food is good for brain health? What food is good for preventing these things? What it comes down to is there's no one food that's going to cause a chronic disease, or also there's no one food that's going to cure a chronic disease. Ultimately, it comes down to overall diet quality and overall lifestyle. So if the majority of the foods you're choosing are, as I mentioned, those whole grains, fruits, vegetables, lean proteins, lean dairy products, and you're including some indulgences here and there, that's absolutely fine. Having a couple of cookies here and there isn't going to cause any issues. You do want to be smart about it if you do have a diagnosis of diabetes so that they don't raise your blood sugars excessively. But planning ahead and using that carb counting model as a guide can help you to include the foods that you enjoy so you're not completely eliminating them from your diet, which can lead to that restrictive mindset. A lot of times we talk about things to remove from diets to improve them. Or that's often just how we kind of think of things. I like to focus on the things we can add in. So including more omega-3 fatty acid foods, things like olive oil, salmon, tuna, different kinds of nuts, almonds, walnuts, avocado. These foods are all great sources of those heart-healthy omega-3 fatty acids. So they're beneficial for helping to raise the good HDL cholesterol. And including fat throughout your day, including a little bit within your meals and snacks is also helpful for increasing satiety to make you feel more satisfied and more full for a longer period of time. Fiber also has that effect. It keeps you more full for a longer period of time. It also helps to control your blood sugars for a longer period of time. So again, fiber foods are going to be those whole grains, those fruits, those vegetables. And remember, as you increase fiber, it's important to also increase water. Hydration in general is important. Water, of course, is the ideal, but unsweetened teas are fine too. You can also include lower sugar drinks, things that are sugar-free. There's a lot of options out there now, seltzers, things like that. I understand water sometimes can get a little boring, so it's okay to mix it up, just trying to avoid those excessive added sugar options. Making sure you're adding in food variety is also important. So if you eat the same foods every day, if you don't make them exciting foods, if you're maybe not seasoning because you feel like you need to avoid salt, things like that, that can get boring. And over time, if you're doing that, it's going to be really hard to stick to that eating plan. So making sure the foods you're choosing are healthy, but also fun and interesting, fun to prepare and fun to eat, enjoyable. is an important part of creating sustainable, lasting changes. I'm a big advocate for enjoying your food. I think it's really important. I also think it's really important to enjoy, foods of your culture, foods that maybe have sentimental, components to them, especially on holidays. It's absolutely possible to include those kinds of items into a healthy diet. Adding in exercise, or I like to call it just movement, is also beneficial. We'll get to that next. And promoting adequate sleep. So if you're not getting 7 to 8 hours of sleep per night for an extended period of time, that can actually lead to increases in cortisol levels. So that is a stress hormone. It can promote weight gain. It can promote a lot of other things. It can also affect your food choices. So if you are feeling very tired or lacking a lot of energy, our bodies tend to crave those very simple carbohydrates because they're quick energy. So by promoting adequate sleep, you're actually going to help to promote your compliance and food choices. When it comes to making changes, it can be helpful to move slowly, which isn't always the preference, I'll say. So picking just 1 or 2 things to work on at a time and gradually adding in those changes can help to once again, create that lifestyle change and promote those sustainable practices so that these items last for a longer period of time. So for example, this is how to move to a Mediterranean diet. So it starts with cleaning out your pantry and getting rid of highly processed foods. From there, maybe reducing the amount of red meat you're eating. It kind of progresses to the point where you are following a Mediterranean diet. Mediterranean diet is not essential. I just thought this was a helpful way of kind of illustrating how to gradually progress to that if that was your goal. I have more examples of creating goals in the next few slides. So in terms of physical activity, adding in more movement is important for promoting health, but it doesn't necessarily have to take place in a gym. So that's why I like the word movement versus exercise, because depending on the person, you don't have to be lifting weights, you don't have to be running to improve your physical activity. There's a lot of ways to do it. So the recommendation is to try to achieve 115 minutes of moderate activity per week, or 75 minutes of vigorous activity per week. So moderate activity would look like, for example, walking a 15-minute mile, riding a bike, dancing, pushing a lawnmower, doing yard work, hiking, actively playing with children, just some examples, versus vigorous activity, which would look like jogging or running, swimming laps, walking up the stairs, jumping rope, aerobics, or just playing a competitive sport. Ultimately, finding an activity that you enjoy is what's going to help you to incorporate it into your day more regularly. If it's something that you're not quite sure what you like yet, I recommend trying out some of these items here. So trying DVDs from the library, accessing YouTube videos, or even trying a phone app. These are all things that are free. So you can kind of experiment and see how you feel about them. If it's something you enjoy doing, you can see yourself doing it for a longer period of time before taking the plunge and maybe investing in something. There's cardiovascular exercise as well as strength training. They both have their own benefits: endurance, strength, balance. They're all beneficial in any shape or form. So I have a picture here of a YouTube video. I've also got yoga. So those are things that are available on YouTube, and also the phone apps. Fit On, for example, is one that is free to use. They have videos ranging from like 5 minutes to 20 minutes, depending on how much time you have and how you can fit them into your day. So in terms of setting goals, it's important to be realistic and be specific with yourself. So for example, I will reduce my soda consumption from 4 cans per day to 2 cans per day. So it's not completely eliminating something that you are used to drinking every day, so it's more likely to last long term. But it is a slight reduction, which is going to be beneficial. Also focusing on what you can add in, not just what you should take out. So for example, I will include 1 serving of vegetables with dinner 3 nights per week. So could you include them every night of the week? Of course you could. But would you do that necessarily? It might be easier to start with 3 nights per week and kind of reassess and see how you're doing with that. You want to make sure you're also including short-term goals and long-term goals. If you set a long-term goal without any short-term goals, it can be discouraging if you're not seeing those results right away. So for example, I want to do a 5K next year. I will start by walking for 15 minutes, 3 days each week. So is that 15 minutes, 3 days a week going to reach that 150-minute goal? No. But if you don't currently do any activity, it's a step in the right direction. And from there, you want to continue to reassess and make adjustments with each of those goals as needed so you continue to progress. As you start to adapt things, it does get easier to continue with them. And then by, maybe after a couple of months, I'm finding 15 minutes, 3 days a week has really become very easy, and I can find myself going even longer. So maybe I'll change it to 30 minutes a day, 3 days each week, and in a couple of months reassess and see how you're doing. So I've included a couple of resources here. So this first one, Healthy Eating for a Healthy Weight, is through the CDC. It just includes additional information with the information I provided based on diet and lifestyle. I also included a link to a USDA site, My Plate, My Plan. This can be used to help to estimate your own calorie needs. So it's going to be based on age, height, weight, and activity level. I find a lot of times that when it comes to making diet changes, trying to be more healthy, especially trying to lose weight, sometimes it can be kind of hard to really establish how much you should be eating. And if you do restrict yourself too much, so if you're getting too few calories throughout the day, it can actually slow down your metabolism. It can lead to losing muscle mass. It can, kind of actually inhibit some of your goals. So having kind of a baseline idea of how many calories to eat per day can be helpful for some people. For others, they don't really want to want to put a number on it. They want to eat what feels good. So if that is something you're interested in, this is a resource that you can access.